Hey, it's Dr. DeCubellis. Today we're going to be talking about chiropractic care in people with scoliosis. Before we get into that, make sure again that you like and subscribe below. I'm going to be coming at you with more content just like this in the future. You want to make sure you don't miss out. Let's go ahead and get started. We're talking about chiropractic care with scoliosis. First, let's talk about what scoliosis is. Scoliosis means that we have a curvature of the spine that shouldn't be there. And we're talking about a curvature to the left or to the right, or sometimes both. So it's side to side, not front to back curves. When we talk about side to side curves, a lot of times people can kind of be bent over like this or bent over the other way. Now, they're not necessarily walking around like that, because what happens is the body starts compensating by using other muscle groups to help try to pull them back over. So they're basically compensatory motion, changing movement patterns, changing biomechanics. The whole goal is that when we have scoliosis, we want to make sure that A, it doesn't get worse, because again, when we're changing movement patterns and biomechanics, things can start to degenerate and deteriorate over time, potentially with that abnormal movement pattern, because it's also creating abnormal pressure over specific or certain joints. So we don't want that to happen. The goal is if we get things to start moving the right way and restore as best as possible normal biomechanics and movement patterns, then we have less chance of having arthritis, degeneration that is forming due to those abnormalities. Now, the big thing is the question is, can chiropractic cure scoliosis? In my opinion, it doesn't. It doesn't necessarily cure scoliosis. It helps, and not only can help correct some of it, maybe not all of it, but saying that it cures would mean that it works every single time. It doesn't, because with scoliosis, it depends on the severity, it depends on the age of the person, and it depends on where in the body it is. All those things have to be taken into account as to what type of treatment would best suit them. Especially when we talk about scoliosis in the thoracic or mid-back area, we want to make sure that it's not bending too far to one area to where we're having issues with heart or lungs. All things to keep in mind. Now, is chiropractic care safe for scoliosis? Yes, it definitely is safe, as long as it's not to the point to where other intervention is needed. Now, another common treatment for scoliosis is where they actually go in and they do surgery. Now, in my opinion, sometimes that surgery is the best thing that can happen, and other times we want to try to avoid it. It all depends on what symptoms the person's having. Here's what I mean. Let's say we don't have a very major scoliosis curve. They're not having a ton of pain. They're getting some minor pain. Maybe it's a 4 or a 5 on the visual analog scale, on a scale of 0 to 10, 4 or 5. And so it's something they can live with, but it's bothering them when they go and, let's say, they walk for longer distances or standing for longer periods of time. If that's the case, I don't know that surgery would be the best option. And most surgeons probably wouldn't want to operate on them. They would be better off doing something like chiropractic care or doing some scoliosis strengthening exercises or something like that, depending on what their case is. Now, however, if they are having lots of issues, or we're worried about heart or lung problems because of that curve, then maybe surgery is the best. The biggest thing we have to remember is when they go in and they put those rods in, you're going to lose all range of motion wherever those rods are. We have to really outweigh the positives and the negatives, and that's what the surgeon would go over with them. Say, hey, this is what would happen, this is why I feel this is the best thing. And then it's up to the patient to make a determination as to whether they want to go through with that. Every case is different. Every case is going to be dependent on the patient and their symptoms and their relationship with the surgeon. I'm not making a blanket comment on one is better than the other in every case. It really just depends. Obviously, the goal, though, is to try to do everything we can to not need surgery, because once you have surgery, you can't undo it. But we can always have surgery at a later date if something conservative type of treatment doesn't end up giving you the results that you want. Chiropractic can definitely help with scoliosis. How much it helps is going to depend specifically on the person, the patient, their symptoms, and then also other things like home exercises or surgery are potential treatment options for scoliosis, but everyone's just so different. It really depends on what's going on with them as to what's the best choice. I hope that answers your question, talking about scoliosis, chiropractic. I hope you got some good information and value there. Again, make sure to like and subscribe, because I'm going to be giving more videos with more information in the future.